Hey, I'm Dr. Dino Pappas with the Rosty Rehab Centers in Northwest Hills. This video is for our patients. I want to talk about sometimes a difficult concept to understand, and that concept is tendinopathies. Tendons are attachments where muscles attach into bone. These areas are notoriously tricky from a rehab standpoint because they require great patience. Unfortunately, with some of these tendinopathies, these are not things that rapidly respond to the services and treatments that we provide. These would be manual therapy, rehab, or things that we don't provide. Sometimes acupuncture, dry needling, therapeutic modalities. Oftentimes these true tendinopathies just don't respond very fast to any treatment that we have out there. That doesn't mean therapy and treatments won't work. That just means the expectation is just a little bit different. So the glass is half full on these. You are going to make progress. It does require some patience. It does require a little bit of your help and assistance with some rehab exercises, which are critical to you getting the benefit from treatment. All right, glass half full. You will get a benefit. We do need your compliance. Please have a little bit of patience with us. The second important part, we want with these tendinopathies, especially if they're acute, they're pissed off, to calm it down before we build it back up. So we can use simple things like ice for pain control. If it's stiff, sore, tired, or achy, it's okay for us with these chronic tendinopathies to use heat. It's okay for us if these are very pissed off and aggravated to use a brace. In the case of tennis elbow, lateral epicondylalgia, lateral epicondylosis, right through here, these tendons attach right into the lateral part of our elbow. It's okay for us to use a little bit of a brace to reduce force specifically to where the tendon attaches into the bone, which is where a lot of the stress and pain is caused. So calm it down, ice, heat, other modalities, maybe even a brace. And then the important part is building it back up once it's calmed down, and that's through a progressive strengthening program. When we talk about a progressive strengthening program, this is point 3. We're in Texas, Austin, Texas. Barbecue is king, right? Like Texas, you know it for barbecue. We like to use the saying, slow cook this like good barbecue. Good barbecue is low and slow, like 200, 210, 215 degrees for 10, 12, 14 hours, especially some of the best brisket like we have in Austin here in Texas, best brisket in the world. Low and slow. Tendinopathy protocols, slow progressive strengthening. This protocol often lasts months, with the initial benefits often conferred beginning at approximately about 3 to 4 months, with many strengthening protocols out there lasting between 4 to 12 months. So if you don't get the benefit in 1 treatment, 2 treatments, 3 treatments like we do at Rosty, where many of our patients benefits in a rapid amount of time, don't give up on the protocol. Reassess approximately about 3 to 4 months of time. If at 3 to 4 months, no progress, let's ditch it and move on. If you are starting to make the initial benefits, initial progress at 3 to 4 months, it's as we anticipated, with this length of time taking again up to 12 months. Okay? We talk about pain. When we strengthen the tendinopathies, these exercises may actually produce some local pain. Local pain would last anywhere from minutes to hours later, but it should revert back to your baseline. All right? And when you're doing these strengthening exercises, we like to say 0 to 4 on a 10-point scale. So 0 to 4 and no more. Producing pain up to about a 4 and no more. At 5, I'm staying alive. Do a pulse check if your pain goes up when you're doing these exercises to a 5 out of 10. Is it 5 out of 10 and trending towards 6, 7, 8 out of 10? Then let's pull back or modify the dose, sets, or reps, or the exercise itself. If it's 5 and it's staying at a 5, just pay attention. If it's 5 but trending downward, that's actually a positive thing, because the tendon adapts by becoming bigger, faster, stronger, harder to kill. And what does that mean? As you strengthen a tendon, it adapts to the force and things get easier with time. If you're producing pain 6, 7, 8 or more out of 10, you like to use the saying 6, 7, 8, I hate. So 0 to 4 and no more. 5, staying alive, pulse check. Trending up, trending down, staying the same. Trending up, let's back it off a little bit. Trending down, that's thumbs up, what we want. At 5, just check it. 6, 7, 8, I hate. Go ahead and pull back from the exercise or modify it significantly. The exercises produce pain but no worse during. That's a key component. To strengthen a tendon, you may cause a little local discomfort during, but after, no worse after, minutes to hours later. We like to start with the progression, and I'm going to use tennis elbow because that's one that we're seeing more frequently. With tennis elbow, we like to start with something called an isometric. and that's lifting or raising the wrist back up into the resistance, meeting the resistance, holding this contraction about 20, 30, 40, 50% of your maximal for 5 to 10 seconds. We usually recommend one set of 10 to 15 reps, 4 to 6 times daily, holding it 5 to 10 seconds. The progression from there is something called a concentric exercise. That's when we bring this up against the resistance, but we take the weight and reduce the force on the way down. Again, this is bringing it up into the resistance, taking the weight, then bringing it down, all right? The next one after that would be an eccentric, where we bring this guy all the way up, and this is a long, slow 5 to 10 contraction downward. 5, 4, 3, 2, 1. Bring it up, bring it down, 5, 4, 3, 2, 1. We can use a weight, we can use a resistance band, we can use manual resistance, however we want to do it, but it's a long, slow decline. That's called an eccentric exercise. The last one is functional loading, and that's whatever you need to do over the course of a day using a screwdriver. If you work out at CrossFit or Orange Theory, or you do some Camp Gladiator things, basically using the barbell resistance or the other resistance, loading it in a functional manner. Again, one set, 10 to 15 reps, 4 to 6 times daily with most of these exercises. 5 to 10 second contraction times is what we want. Again, this protocol is 4 to 12 months long. Initial benefits are 3 to 4 months. So let's not get a little haste if it's 3, 4, 5 sessions over a month and there's no progress. The progress comes with loading the tendon, the tendon adapting over time. Why does a tendon adapt so slowly? Because tendons have typically bad blood flow. Bad blood flow means poor nutrient exchange. Poor nutrient exchange means that they're slow healing areas. The last thing, if we get to about 3 or 4 months and we realize we're not making any progress whatsoever, let's talk about how we take our foot off of the brake. And what does that mean? There may be psychosocial concerns. Those are things like daily life stresses, fear. I fear that this is never going to get better. I avoid certain exercise. I've got life stress, work stress, husband stress, wife stress, kid stress. See if we can reduce some of those psychosocial stresses that would slow the process down. Let's talk through these issues, or let's issue a referral to somebody that can delve into these concepts a little bit more. Maybe there's some metabolic concerns. Maybe you've got thyroid issues, diabetes, maybe cholesterol issues or an autoimmune disease, which slow down soft tissue healing. So let's talk about a referral to functional integrated medicine. Maybe it's a schedule. Maybe we need to set a timer on your phone, and every time that timer goes off, stop what you're doing and do your exercises. Or have you really been compliant with these exercises? I know it seems like we're asking a lot. One set, 10 to 15 reps, 4 to 6 times a day, 5 to 10 seconds. But if we don't do it, we're not going to get the progress. And doing one set, 10 to 15 reps, 4 to 6 times daily, 5 to 10 seconds, literally will take you total over the course of the day, 10 to 15 minutes. If we don't have 10 to 15 minutes total over the course of the day, we really have a problem there, and we really need to talk about your lifestyle and your stressors there. All right? I'm Dr. Dino Pappas with the Rosti Rehab Center. We fix pain fast.